This presentation is on tuberculosis, otherwise known as TB. The presenters are Josie, Elizabeth, Carrie, and Emily.
Patient X comes into the doctor exhibiting many symptoms. The symptoms that patient X shown were coughing, sometimes including blood, fatigue, weight loss, fever, and in many cases, no symptoms at all. To back up his belief that the patient X has TB based on the shown symptoms, the doctor decides to request a blood test and skin test to see if patient X is infected with the TB bacteria.
Because the doctor suspects that the patient has tuberculosis, he is going to do this variety of tests to determine exactly what kind of tuberculosis she has. Now he needs to do this because TB is a bacteria that spreads infection through the blood. The blood carries this infection all throughout the body, and it can settle and cause an infection anywhere in the body. However, TB usually causes infection in the lungs, and so when you think of tuberculosis, most people think of infections of the lungs. But because TB spreads infection through the blood, there are two ways that you can have TB. You can have it as an infection or as a full-on disease. If you just have a TB infection, that means that there is some tuberculosis bacteria present in your body, but that's not causing you any problems. If you have tuberculosis disease, then that bacteria has caused an infection in your body, such as problems in your lungs. The doctor uses different diagnostic methods to differentiate between the two, infection or disease, to determine exactly what the patient has. The first test that the doctor will run is what's called a tuberculosis skin test. In this, he's going to inject a small amount of a liquid called tuberculin under the skin, as is shown in this picture. If a patient has been exposed to the tuberculosis bacteria, if they have an infection, then this tuberculin will cause a reaction on the skin as an immune response. The patient will come back in 48 to 72 hours, and the doctor will check and see if any response was present. This test helps doctors know if the patient has an infection of tuberculosis, that is, if any bacteria is present in their body. Similarly, blood tests can be used to determine if the bacteria is present in the person's body. Chest x-rays are used to diagnose the tuberculosis disease, not just the infection. Because tuberculosis often settles in the lungs and causes infection there, this infection shows up on a chest x-ray. If the patient has tuberculosis problems that show up in a chest x-ray, it shows that they have the actual disease, not merely an infection.
The treatment for active tuberculosis requires a combination of several antibiotics to reduce the risk of development of resistance. It is also recommended to have directly observed therapy so that it is ensured that medication is being taken appropriately. If not taken properly, a secondary resistance to the antibiotics may occur, rendering their usage ineffective. Those who have TB but do not show any symptoms tend to only need one specific antibiotic, and they are treated mainly to prevent the risk of TB progressing and becoming active later in life. Sometimes vaccinations may also help prevent TB, but generally they're used in children and in very high risk cases because they are uncommon and more expensive. The most widely known used one being BCG. The recommended treatment for tuberculosis is a 6-month combination of antibiotics. These include isoniazid, rifampicin, pyrazinamide, and ethambutol for the first 2 months, and only isoniazid and rifampicin for the last 4.